Hi, my name is Liz, and today I'm going to be teaching you how to administer a test on pinch strength using the pinch gauge. We would administer this test on patients who have limitations in hand functioning stemming from osteoarthritis, stroke, spinal cord injuries, or carpal tunnel syndrome. We would not want to administer this test if the patient has excessive pain, active inflammation, or hand lacerations. When administering the test, we would want to make sure that the patient has muscle contraction first, a joint range of motion, and is able to tolerate resistance. So I'm going to teach you how to read it before I actually demonstrate the test on a patient. So the patient would grasp here and apply pressure, and in doing that, we'll be moving these two needles here on the dial. There is two needles. There's one black and one red. The black needle pushes the red needle to the pounds or kilograms of force applied. And the red needle stays there so that the administrator is able to record the data. We'd always want to make sure that we rotate this little knob here and get both of those needles back to zero before beginning our assessment. So I am now going to bring Emily here and administer her pinch strength. So there are three separate types of pinches that we administer. There is first the key pinch, which basically you're holding a key in your hand. That is your thumb on top of the lateral side of your index finger. We also do want to make sure that our patient is sitting with their feet flat on the floor. Their arms should be adducted to their body and their elbow in a flexion of 90 degrees. So I'm going to make sure that I hold on to this little safety device here so it does not fall on the floor because it's very precious. And she is going to just pinch and release. And it looks like she has about 14 pounds here. And we would do that test 2 more times and take the average of her key pinch strength. The next pinch that we are going to do is the tip to tip, the tip pinch. And she's going to do the same thing. And it looks like about 11 pounds here. And we always want to make sure we set that back to zero before doing the other one. And again, we would take 2 more trials of that and then average those three together. The next one that we will be doing is the tripod or palmar pinch. And we'll go ahead and do that one. Okay, it looks 16 pounds here. And we would also take 2 more trials and average those 3 together to get the average of her palmar pinch. The pinch strength is very important in our everyday lives for picking up medication, starting our car with that key pinch, or in handwriting and that palmar pinch, being able to hold the pencil or pen to write. We do this test to establish a baseline for treatment, to help set goals, and to monitor the progress our patient makes through treatment. So that is testing our pinch strength with the pinch gauge.